has a dirty secret it can no longer hide, fueled by a cheap and deadly new drug, fentanyl. Violent crime and desperate homelessness have exploded across the streets of San Francisco. But at ground zero, you'll find a team of Aussie angels, as Seven's US Bureau Chief David Woiwod discovered.
"70 seconds. That is how fast an entire night can change on the street. Not because of a storm, not because of a fire, but because of something you can't see. A powder so strong and so unpredictable that people don't always realize what they were exposed to until their body starts shutting down. A drug that shows up in the shadows of cities, in parking lots, under overpasses near shelters, and along sidewalks where human beings are already living one emergency at a time. Tonight, we're talking about fentanyl and homelessness in America. And before we begin, a quick promise. This episode is not graphic. We will not show or describe drug use. We will not give instructions for wrongdoing. We will not glamorize addiction. We are going to do something harder than shock. We are going to look at how fentanyl keeps tightening its grip on people who already have the least protection, why this crisis keeps repeating, and what actually helps people survive long enough to recover. This is Homeless US News, and this is the story of a nation that keeps finding people only after they've already fallen. The drug you can't outrun. Fentanyl did not begin as a street drug. It began as medicine. In hospitals, it has legitimate medical use for severe pain, controlled and carefully measured by professionals. But on the street, it becomes something else entirely, a roulette wheel in a plastic bag. One of the cruelest details about fentanyl is how small it can be, and how hard it is to detect without specialized tools. People say it's invisible, and what they mean is this: you can't rely on your senses to protect you. You can't taste safety. You can't smell danger. And on the street, where everything is already improvised, that uncertainty turns every day into a gamble. Now add homelessness to that equation. Homelessness is not just the absence of a roof. It is the absence of stability. It is being exhausted in public. It is trying to sleep while staying alert. It is carrying your whole life in a bag. It is losing documents, losing phone service, losing the ability to be reached. It is having nowhere to rest when you're sick, nowhere to cool down when it's scorching, nowhere to warm up when it's freezing. And fentanyl thrives in instability. When you have a home, you can recover from a bad day behind a locked door. When you don't, the bad day follows you. For some people, fentanyl enters the story as pain relief, a construction injury, a chronic condition, a surgery, a prescription that runs out. For others, it enters as escape. Not escape in a glamorous way. Escape in the smallest way. Escape from panic, from trauma, from grief, from the kind of loneliness that makes your chest feel too tight to breathe. Outreach workers across the country describe the same pattern. People don't necessarily chase a high, many chase silence. A few hours where their nervous system stops screaming. But fentanyl does not give silence for free. It charges interest, and it collects. A man in an encampment once said it like this, speaking to a street outreach volunteer who'd heard it all before. At first it feels like the world finally turns down the volume, and then it turns the volume back up so loud you can't think. That's the loop. Relief, then wreckage. Calm, then chaos. Sleep, then sickness. And when you are homeless, the consequences multiply because there is no safe place to fall apart. There's no bathroom to be sick in, no bed to sweat through, no family member waking you up to make sure you're still breathing, no one checking on you if your tent stays zipped too long. Which brings us to the most brutal fact of this crisis. Fentanyl doesn't just punish addiction, it punishes isolation. Why homelessness makes fentanyl deadlier. Here's the part many people get wrong. They imagine addiction first and homelessness second. They imagine a person choosing drugs and then choosing the street. But on the ground, the timeline is often messy. Sometimes homelessness comes first, and fentanyl arrives later, like a predator sensing injury. Because street life creates pain non-stop, physical pain, infected wounds, untreated dental problems, injuries that never heal right, repetitive strain from walking all day, sleeping on concrete, carrying heavy bags, exposure to heat and cold, emotional pain, family separation, violence, humiliation, constant threat, losing your sense of identity, the daily reminder that people are looking through you instead of at you. And then there is medical scarcity. When you don't have consistent health care, little problems grow into emergencies. A cut becomes an infection. A cough becomes a hospital visit. Anxiety becomes crisis. Depression becomes paralysis. Trauma becomes the only language your body speaks. In that environment, fentanyl is not just a drug. It becomes a shortcut, a counterfeit solution to real suffering. But the shortcut is lined with traps, because fentanyl doesn't always show up alone. It is often found mixed into other substances, or pressed into counterfeit pills that look like something else. That means people can be exposed without seeking it out. And on the street, where people share, trade, and rely on informal networks, the risk spreads fast. Then comes the second multiplier, survival pressure. If you have a home, you can miss work and still have a bed. If you're homeless, missing one day can mean losing your spot at the shelter, losing contact with a caseworker, missing a clinic appointment, losing a job interview, losing your only ride. So people push through sickness. They self-manage withdrawal. They try to function with a body that feels like it's on fire. And if they can't, the street punishes them. They lose their camp. They get swept. They get cited. They lose their ID. They lose their meds. They lose the last person who knew their name. This is why fentanyl has such a devastating footprint among unhoused populations. Not because unhoused people are worse, but because their environment is more lethal. Because the margin for error is thinner. Because there is no cushion. Because the street is already a crisis, and fentanyl stacks another crisis on top of it. Now it's stigma. Stigma is not just hurt feelings. Stigma is policy. Stigma is fewer services. Stigma is delayed care. Stigma is people avoiding clinics because they've been treated like a problem instead of a patient. Stigma is why someone can be dying in plain sight while passersby step around them and keep going. Which leads us to the moment this crisis becomes visible to the public. The overdose call, the siren, the ambulance, and the strange, modern reality of American streets. The same person being revived again and again and again, because we keep saving lives without changing what those lives return to. The overdose loop and the new front line. If you want to understand this epidemic, stand with first responders for one night. Not because it's dramatic, because it's repetitive. A call comes in. Someone is down. Someone isn't responding. Someone is barely breathing. The response is fast because time matters. And in many places, more people carry naloxone now than ever before. Outreach teams, shelter staff, librarians, transit workers, teachers, people who never expected to be part of emergency medicine are now part of it. That is what a national emergency looks like. It changes the job description of ordinary life. But here is the part that breaks people. Sometimes the person survives and wakes up disoriented, scared, ashamed, angry, or exhausted. Sometimes they leave before anyone can talk to them about treatment. Sometimes they refuse transport because they've had bad experiences in hospitals. Sometimes they go, sit in a waiting room for hours, and leave because withdrawal feels unbearable, and they need relief immediately. And then, too often, the cycle resets. A paramedic in a major city described it in one sentence that should haunt us. We can bring them back. We can't bring them back to a home. Because where do you recover from an overdose if you live on the sidewalk? Where do you rest if your body is depleted and your brain is rattled? Where do you go if the shelter is full, the clinic is booked, and your only community is the encampment you're told to leave? This is the fatal gap in the American response. We treat overdoses like isolated events. Instead of symptoms of a larger system, we focus on the moment of crisis, not the pipeline that creates it. And the pipeline is clear: housing instability, untreated mental illness, economic pressure, trauma, a fragmented healthcare system, a drug supply that is increasingly unpredictable, and public policies that often treat homelessness as a nuisance to manage, rather than a human emergency to solve. When people say, "Why don't they just stop?" they're asking the wrong question. The question is, what would they stop into? Because stopping doesn't mean much if the destination is still an alley, still a tent, still a park bench, still the same threats, the same hunger, the same fear. Recovery is not just abstinence. Recovery is stability. It's sleep. It's routine. It's a door that locks. It's a safe place to be sick. It's someone calling you by name tomorrow. And that brings us to the most uncomfortable truth of all. The fentanyl crisis is not only a drug crisis. It is a housing crisis. It is a healthcare crisis. It is a loneliness crisis. The systems that break people, then blame them. When a housed person struggles, the system often offers steps. Make an appointment, show up on time, bring your insurance card, fill out the forms. When an unhoused person struggles, the system often offers obstacles. No phone means no reminder texts. No transportation means missed appointments. No ID means no intake. No stable address means lost paperwork. No safe storage means stolen medication. No shower means being turned away by employers. No sleep means cognitive fog that makes bureaucracy feel impossible. And then we judge the outcome. We call it non-compliance. We call it failure. We call it refusal. But what if it is exhaustion? What if it is a brain that has been in survival mode for too long? What if it is trauma? People who have lived through violence, exploitation, or repeated loss often develop nervous systems that interpret help as danger. Not because they're irrational, but because experience taught them that promises get broken. So when someone offers a program with rules, curfews, and strict compliance, some people don't hear support. They hear control. They hear punishment. They hear, "You will lose what little autonomy you still have." And sometimes, they've experienced shelters that were unsafe, or crowded, or chaotic, or full of theft, or humiliating, or incompatible with a partner, a pet, a disability, or the mental health needs that made the street feel like the lesser evil. This is why the conversation has to expand beyond beds. A bed for one night is not recovery. A motel voucher is not a life. A sweep is not a solution. If anything, constant displacement makes fentanyl more dangerous. When camps are broken up, people lose contact with outreach workers. They lose the person who had naloxone. They lose the neighbor who checked on them. They lose the routine that kept them alive. And in many cities, the criminalization of homelessness adds more weight to the chain. Tickets and fines pile up. Court dates are missed. Warrants follow. Jail becomes a revolving door. And when people come out, they come out to the same street, often with less trust and fewer options than before. This is not just inefficient, it is expensive, and it is cruel. The tragedy is that we already know what tends to work better. We know that stable housing reduces chaos. We know that mental health care works best when it's consistent. We know that treatment works better when it's accessible and non-punitive. We know that connection saves lives. So why do we keep investing in responses that preserve the crisis instead of ending it? Part of the answer is fear. Fear of encampments, fear of public drug use, fear of crime, fear of attracting homelessness, fear of costs, fear of change. But fear is not policy. Fear is a reaction, and fentanyl feeds on reaction. Because when our response is only to push people away, we push them into deeper isolation. And isolation is where the risk gets highest, where overdoses go unseen, where help arrives too late, which leads to a question we rarely ask out loud. What kind of country responds to people dying in public by making them harder to find? The market of misery and the lies people have to believe. There's an uncomfortable reality underneath fentanyl's spread. It is a product in a marketplace, and like any product, it moves fastest where demand is highest. Demand grows where pain is constant and relief is scarce. For people sleeping outside, pain is not occasional. It is daily. It is structural. So the sales pitch is simple: warmth, relief, sleep, escape. But it is a lie, because fentanyl doesn't solve the pain. It postpones it, then returns it with interest. It doesn't remove trauma. It amplifies it. It doesn't end suffering, it deepens it, until the person has to use just to feel normal, just to stop shaking, just to quiet the storm inside their body. And when fentanyl shows up mixed into other drugs or counterfeit pills, it adds another layer of cruelty. People can't reliably know what they're dealing with. That unpredictability is part of why overdose risk is so high across communities, including among people who did not intend to encounter fentanyl at all. Now zoom out. When communities see this, they often stop at anger. They say, "Why are they doing this here?" They say, "Why can't they just go somewhere else?" They say, "Why don't we arrest our way out of it?" But arrest doesn't rebuild a life. It interrupts a day. And when someone returns to the street with no housing, no treatment, and no support, the crisis continues. Meanwhile, shame grows like mold. People become less likely to seek help, less likely to enter treatment, less likely to trust services, less likely to believe they deserve a future. This is one of the most lethal parts of addiction, the story a person tells themselves. "I'm too far gone. I messed up too many times. Everyone is tired of me. I'm not worth saving." Fentanyl thrives inside those sentences. So the real work is not only medical, it is human. It is interrupting the story. It is an outreach worker sitting on a curb and saying, "I'm still here. I'll come back tomorrow." It is a nurse treating someone with dignity. It is a case manager celebrating one small win. It is a shelter offering safety without humiliation. It is housing without impossible prerequisites. Because the opposite of addiction isn't just sobriety. The opposite of addiction is connection. And connection requires a society that stops treating people as disposable. What actually works, and what IT costs to do nothing? There is good news, and it matters. In recent years, national overdose deaths have shown signs of decline. And many experts point to expanded access to naloxone and other public health efforts. As part of that shift, that tells us something important. Action works. Lives can be saved. The story is not fixed, but the progress is fragile. It can reverse if we treat it like a trend instead of a responsibility. So what does an effective response look like when fentanyl collides with homelessness? It looks like layered support, not what-I'm interventions. It looks like housing as a foundation, because it is nearly impossible to stabilize health while sleeping outside. Housing is not a trophy for people who earn it. It is the floor that allows people to stand up again. It looks like low-barrier treatment access, including detox and medication-assisted treatment, without months-long waiting lists and impossible requirements. If someone is ready today, come back next month can be a death sentence. It looks like street medicine and mobile clinics that meet people where they are. Because expecting a person in survival mode to navigate complicated systems is unrealistic. It looks like behavioral health care that is trauma-informed and consistent. Not only crisis response, it looks like harm reduction that keeps people alive long enough to recover. That includes education, naloxone availability, and tools that help reduce accidental exposure. The goal is not to approve of addiction. The goal is to prevent death. It looks like prevention because the cheapest, most humane solution is to stop homelessness before it starts. Rental assistance, eviction diversion, domestic violence support, medical debt relief, reentry support, youth aging out of foster care with real housing options. These are interventions that keep people from ever reaching the sidewalk. And it looks like public honesty. No more pretending we can sweep our way out of this. No more pretending the crisis is someone else's problem. No more pretending fentanyl is only a bad neighborhood issue. The truth is brutal, but it can also be motivating. Most people are closer to homelessness than they think. One job loss, one injury, one rent increase, one family crisis, one medical bill. That doesn't mean panic. It means empathy. Because when you understand how quickly someone can fall, you stop asking, "What's wrong with them?" And you start asking, "What happened to them? And what would I need if I were in their place?" And when a society asks better questions, it builds better answers. The question that decides who we are. Fentanyl is not just a chemical. It is a stress test. It tests our healthcare system. It tests our housing policies. It tests our willingness to treat suffering as real. even when it is inconvenient to witness. But most of all, it tests our compassion, because the people most at risk are often the people we step around, the people we call them, the people we try not to see. And here is the truth that should sit heavy in your chest. Nobody becomes the homeless. They become a person without a home. A person, a veteran who still remembers how it felt to belong. A mother who is trying to keep her child calm in a world that won't slow down. A young adult aging out of the system with nowhere to land. A worker who can't afford rent in the city they serve. A human being whose pain got too big to carry alone. If you remember just one thing from this documentary, let it be this. You cannot punish people into healing. You cannot shame people into recovery. You cannot sweep people into safety. But you can build a bridge back. You can support local street outreach and shelter organizations. You can advocate for housing and treatment resources in your community. You can push leaders to fund solutions that actually reduce suffering instead of relocating it. You can vote like housing is healthcare, because it is. And on a human level, you can do the smallest, most powerful thing. Acknowledge someone's humanity. A nod, a hello, a bottle of water on a heatwave day. A moment of respect. It won't solve everything, but it fights the one thing fentanyl relies on most: invisibility. If you or someone you know is struggling with substance use or a mental health crisis in the United States, help is available. You can call SAMHSAS National Helpline at 1-800-66-HELP for 1357. And you can also dial 988 for crisis support. This is Homeless US News. If you want more reporting like this, support the channel by liking the video, subscribing, and sharing it with someone who needs to see it. And tell us in the comments what city, what neighborhood, or what issue you want us to investigate next. Because the measure of a nation is not how bright its skylines are. It is how many people we refuse to leave behind in the dark.